Here is your question. Right, so if you have read and understood, kindly begin your examination.
Right. So I've washed my hands, entered the station. I'm meeting the candidate. Hello, my name is Dr. Nada, one of the surgical candidates. May I know your name and age, please?
Yes, I'm Samantha, 40 years old.
Nice to meet you, Samantha. So Samantha, today I've been asked to examine your back, the examination and your legs. The examination will involve me having a look at your back, watching you move and feel your joints. Would that be okay with you?
Yes.
So do you have pain anywhere before we begin?
Yes, but negligible. You can continue.
Sorry, come again?
You can continue your examination.
Right. So Samantha, can you walk a few steps for me? So
okay.
I'm checking the gate. You have to walk towards the wall and please come back towards me.
Yes.
So since it's spine examination, I'll make her walk and see the gate stance. Samantha, I would like you to stand in front of me. I'm having just a look at your posture. So I'm inspecting the patient from front. Since she's a female patient, I've not exposed her. Ideally, there should be exposure to see the bones and the muscle wasting clearly. So inspecting it from the front, can you turn your one side towards me? Inspecting the curvature of the spine, the cervical, the lumbar, and the thoracic from the side. And please, can you turn your back towards me? I'm inspecting the spine from the posterior side. With that, I have completed my inspection. Samantha, can you go towards the wall and with your arms, with the help of your arms, just push the wall with both of your arms. As the patient does this, I'm checking for the winging of scapula. I also would do, if the patient is, I've done my inspection, now I will do palpation, which is feel pain anywhere.
Yes, continue.
Hello? Yes. Yeah. Okay. So I'm now palpating the temperature. First, I'm checking the joint temperature of the spine. Now I'm palpating the joint from the back, starting from the occiput all the way to the back. Now I'm palpating the posterior superior iliac spine and the sacroiliac joints. Once I have palpated all the spine, now I'm going to palpate the paraspinal muscles. Samantha, please let me know if you have pain anywhere. I'm going to palpate the paraspinal muscles on both the sides, the right and the left. After I have done all these palpation, now I will going to check some of the spine movements, starting with the cervical movement. Samantha, can you look towards the ceiling? That is cervical extension. Can you touch your chin on your chest? That is cervical flexion. Can you turn your face on the right and the left? That is cervical rotation. Can you try to touch your ear with your shoulder on both sides, right and left? That would be lateral flexion. So movements on the cervical spine have been checked. Now I'm going to check the movement on the lumbar spine. That is, Samantha, can you try to touch your feet? Can you try to bend and touch your feet. So that is flexion at the lumbar joint. And can you try to bend your bend backwards? So that is a lumbar extension. Also, Samantha, can you please stand up and try to touch your knee with your left arm, and then try to touch your right knee with your right arm. So that is lumbar lateral flexion. Now, Samantha, you can please sit down, put your hands on both of your shoulders, cross them and turn towards your right, and then turn towards your left. So that is the thoracic flexion. Thoracic rotation. So the movements on all the spines have been checked. After that, I'm going to do some special tests. Samantha, I'm going to do a test at your back. I'm going to mark it, right? So I'm standing at the back of the patient. I'm palpating the posterior superior iliac spine, have made a mark on posterior superior iliac spine, then measure 5 centimeters below, mark it, and then measure 10 centimeters above and mark it. Now, Samantha, can you please bend down? When the patient is bending down, I'll measure the distance between the 3 marks, basically the 10 centimeter and the 5 centimeter marks. So the distance should increase to 20 centimeters normally. If it does not, that means the patient has flexion deformity. After I have done this test, I would ask the patient to lie down. Now I'm going to do the SLR test. In that, I'm going to raise her right leg and to 90 degrees, and let me know if you have pain anywhere, and doing the same on the left side to the 90 degrees. But in that case, patient will have pain probably on the left side, and maybe the SLR is reduced. After that,
can you summarize your examination now?
So I have examined Samantha, a 40 years old female patient who had pain in her left leg. On examination, the inspection did not have any scar marks or any muscle wasting or any fasciculations. The movement on the spine had normal curvature. There was no joint tenderness or no joint tenderness or no paraspinal muscle tenderness. The Schober's test would show reduce or fixed flexion deformity, or the SLR would be reduced on the left side. I have not completed the test, so femoral nerve stretch test was remaining. Yeah, I think.
What is your provisional diagnosis?
Ma'am, my provisional diagnosis would be either the patient has lumbar disc herniation, it could be sciatica, or it could be spondylosis.
2, you have given me. Anything else? How would you confirm your diagnosis?
Ma'am, I'll confirm with the help of one is the complete examination. The steps which I've missed, the femoral nerve stretch test, number 1. Number 2, with the help of spine X-ray and MRI lumbosacral spine.
Okay, what are the treatment or management that you can offer?
Ma'am, we'll offer some analgesics, some physiotherapies, and some exercises. Also ask the patient to avoid sitting on the floor, or avoid doing work which involves the movement on the
conservative management fails.
Conservative management.
If conservative management fails, then what can you offer to the patient?
Ma'am, if conservative is not helping, we can ask the patient we can advise her surgery, which is laminectomy. It can be a laminectomy or laminectomy.
Or
for
discectomy.
Or discectomy, yes.
Okay, right. Good. Thank you.
Thank you so much, ma'am.
A lot of things that you have missed. Yes, Dr. Abbas has raised hand. Yes, please. Yes, please.
Thank you. Thank you very much,
yes.
Dr. Nida. Thank you very much, ma'am, for the opportunity. Dr. Nida, well done. It's yes, you took a lot of time examining the spine, and then you missed the other parts of the question.
Yes.
The question says examine the spine and then do a neurologic examination of the lower limb. I think that was the question. So my humble advice is that considering the fact that the symptom is localized to the lumbar spine, you should focus your initial examination on the lumbar spine. Leave the cervical alone. Because I don't think that's necessary to examine the cervical spine. Yes, that's one part. Then two is that after you've examined, you've inspected, and then you do your movement. Please look, feel, and move. Yes, you are correct for the lumbar vertebra when you inspected, and then you palpated and you felt and you moved. Yes, for assessing to ruling out ankylosing spondylitis. Immediately you finish that, then you did your straight leg raising. That's for the Slr test, and then the next thing you're going to do straight is to do your motor examination and then your sensory examination. For the lower limb. Yes. So you check for the bulk, the tone, the power, and the reflexes. Then you check for sensation. And then you check for, then you now do your femoral nerve stretch test. Immediately you do that, then you're essentially done with your examination. Then you just tell the examiner you would like to examine the joints. That's the knee and the knee joint. That's when you're then tell you to summarize. I would have loved to examine the knee joint and the thoracic vertebra.
Hip.
Sorry, yes, ma'am.
Right.
Hip joint and the thoracic vertebra.
And the cervical, yes.
Yes, yes, ma'am. And then I would also love to do a vascular assessment of the lower limb. Considering the patient presented with symptoms that looks like a claudication, however, it's more like a neurological claudication. So you just say, I would want to do a complete vascular assessment of the lower limb. So I think that's just my contributions on that. Thank you very much.
All right. Thank you. Thank you so much, Dr. Abbas.
Dr. Muhammad Ali raised hand as well. Yes, please.
Yeah, ma'am, this is exactly what I was thinking. It is not possible to perform both examination in 6 minutes.
At the same time. Yes.
But and there is one question again. Like in this patient, there was a clinical scenario, like probably sciatica. So we will do an abbreviated examination targeted on that condition, right?
Yes. To begin with.
Similarly, in the previous case, Dr. Landip case, that is Dr. Karma's case, it was a swelling in the ankle. So will it be possible or even practically possible to ask the patient to walk if he has swelling and he has...
Patient we'll discuss that later. First, this one. Okay.
Yes.
So, yes, right. How would you know, right, in this one, if it's because Dr. Abbas said he would want to go ahead and rule out the vascular examination as well. So how would you know the difference if the patient has neurological deficit or the vascular deficit? So all of you, including Dr. Nida, should answer. Yes.
Ma'am, temperature, when you're gonna check the temperature of the leg?
Think.
Ma'am, one is the history itself.
ABPI.
ABPI, yeah.
Yes. So in case of neurological, ABPI will be normal, and GP will send the patient and would say that ABPI is normal. See, so it's neurological. Whereas for vascular, ABPI will be, you would have to do it. So Doppler will be there. So you would have to check here.
Right, ma'am.
There'll be hammer, there'll be cotton wool, there'll be tip, etc. So, all right, in the beginning, if I can give you my little feedback, why have you differentiated or discriminated female patient? You said it's a female, so I will not ask her to take the top off. Why?
Ma'am, because of to maintain the dignity, I'm not sure if we can.
Dignity? Of course, you can say, please take off the gown, keep the undergarments on. So that's you have to be like professional. If it's a male or a female, you're not going to discriminate. As a professional, just show professionalism. Say, okay, take off your gown, keep your undergarments. Say it loudly so they know that you are asking to keep the undergarments on. So then you move on. Because otherwise, how are you going to examine? Like
exactly.
Come on. You're not seeing, you cannot comment. So first, this was wrong. Then, yes, Dr. Abbas said you spent too much time on that cervical, so you couldn't complete the rest of the things. So yeah, motor coordination was there.
Right,
reflexes you had to do for both knee and the ankle. And then there was tone and the clonus you had to look. In the tone, that was the leg lift and the leg roll you had to do. And then last was the femoral nerve stretch test, which would be negative. Right?
Okay, yes, ma'am.
Yes. And
right.
When I asked you for the differential diagnosis, I don't think that you gave me 3, 4. I normally tell everyone that they should have 3 to 4 differential diagnoses on the tip of their fingers, and they should tell those. Yeah.
Right, ma'am.
Second could be spinal canal stenosis, and then yes, right. There could be, fourth could be peripheral neuropathy because of diabetes mellitus, or there could be vitamin B12 deficiency or any drug therapy or anything. So yeah.
Right.
So we'll do that again once more, so that
yes, ma'am, sure, definitely.
We'll focus more on the question. So that was very good what Dr. Abbas said. You have to read the stem and you have to focus your examination accordingly. You can't just do all the tests that are given for that particular condition. You can't. So you have to be focused.
Right, ma'am.
Good.
Right. Thank you so much, ma'am.
Thank you. Let me end this and then answer. Started.